Fighting HIV among African Americans, a heightened national response. HIV remains a persistent and pervasive threat to the health, well-being, and human potential of many African American communities. As the impact of the epidemic among African Americans has grown, the Centers for Disease Control and Prevention, CDC, state and local public health agencies, and African American communities have stepped up efforts to address the crisis. While we have seen important signs of progress in reducing risk in many African American populations, the impact remains severe. Today, a heightened national response is urgently needed to build on progress to date and meet the serious challenges that remain. African Americans are severely and disproportionately affected by HIV. While blacks represent approximately 13% of the U.S. population, they account for approximately half of the more than 1 million Americans currently estimated to be living with HIV and have represented 40% of all deaths among people with AIDS in the U.S. to date. As new treatments have expanded the lifespans of people infected with HIV, the number of African Americans living with HIV continues to increase, creating more opportunities for HIV transmission. Fortunately, even in the face of rising HIV prevalence, there have been no indications of increases in the overall rate of new HIV infections among African Americans. In fact, there have been signs of possible reductions in new infections among blacks in some areas hard hit by HIV, such as the state of Florida, and in populations hard hit throughout the country, including injection drug users and African American women. Additionally, mother-to-child transmission of HIV, which largely affects African Americans, has been dramatically reduced, and African American teens have reported significant declines in sexual risk behavior and increases in condom use in recent years. Yet more must be done to address the impact of HIV among African American men, women, and young people. The latest CDC data on new HIV diagnoses reporting show that African American males continue to bear the greatest burden of HIV in the U.S. The rate of HIV among black men was nearly 7 times higher than that of white men, and more than twice that of black women. African American women are also severely affected. Among black women, the rate was more than 20 times that of white women. Racial disparities in HIV diagnoses are particularly severe among young people. Overall, blacks made up 51%, of all new HIV diagnoses between 2001 and 2005.